please. Could there be non-muscular pain years after surgery, and what's the risk? Okay, that's a great question too. So I guess the general underlying question is, if I'm want my child, teenager, or adult to have the surgery, is it going to create pain later on? All our data suggests the opposite. So when we go back and we look at the data and we collate it and we're putting it more and more detail, we get pain scores before surgery and after. And the majority of patients report 3 or 4 years later after surgery that their pain is actually lower than it was before surgery with the correction that we do. Now, even for corrections, for instance, we have 97% success rates of getting our corrections down. Well, 97% is super, super high, great surgery. That's not 100%, which means that even for pain, there's going to be perhaps somebody who has pain later. But overall, that risk is very low. And if you compare it to the alternative metal rod, the metal rod fusion rate for chronic pain 5 to 10 years out from surgery is as high as it's quoted between 17 and 60%. 5 years, 20%, 30, it's a high number. And it's a combination of factors. You're transitioning structures or all the movement to above or below, the junctional failure rates, all those things, no motion in your back muscles. So you also have to keep that in perspective. What's the relative risks compared to what else is there? But there can also be a lot of other reasons. I just want to touch on two. One is we don't cure scoliosis. We correct the curve where we operate. You can still have a residual curve above or below, and you're dealing with the aging of that spine as it goes on. So that's one reason. A second reason is, and which is why we keep evolving our technique to more and more, and now for the last 5 years, every level being released, is that in our 2015 to 18, 19 time period, I would make a correction, and so it would be from here to here if it's a double curve. And then as VBT would do, if you don't release the levels, the cord breaks and it migrates back some. Because of the technique of ASC, where we released other levels, we were able to hold the curves into a non-operative curve. But that slight loss in those categories could lead to some pain. And so of the ones I do know about online that talk about their pain from ASC surgery, I can almost always go back and define it exactly to a cord break at unreleased levels. And our data suggests that too, that with all the breakages that we do see, they're almost invariably at unreleased levels. And so there's lots of factors here that go into play. I would say the number one reason is actually just structural change over time, not necessarily related to surgery itself. And the risk of pain from surgery itself is actually very low.